question was, is there a cluster in the acreage? A cluster simply means that you have an elevation in a specific disease, in a specific area, in a defined period of time. That's what the cluster means. So yes, we have a cluster because we have an elevation of pediatric brain cancer in the area calling the acreage in the time period that the study was done. It does not mean that this elevation is related to any specific cause or that it's linked to any kind of contaminant. And at this point, we have not seen that to be the case. So having said that we have a cluster out in the acreage does not mean that that's the only place where this exists. As a matter of fact, I believe that pediatric cancer actually is increased probably throughout our county and in South Florida. So therefore, what I think is important and what is significant is that we need to do more research in the area of brain cancer to find out what causes brain cancer. In order to find out the cause, we have to do further science in general, not the health department and not any one entity by themselves. But there has to be a lot more studying of brain cancers in the pediatric population to even come close to get a cause and effect. They have a lot of hypotheses as to what could cause worldwide increases in pediatric cancers. If it's associated with the industrialized world, there are many hypotheses. I mean, there's things like cell phones, microwaves, diet drinks, sugar substitutes, everything that you can think of that could be hypothesized in terms of what is causing this. But no one has come up with a cause and effect yet to this point.
How do parents get their children diagnosed? I mean, that doesn't sound like something that health insurance would cover. That sounds like something they would have to ask for specifically and pay for specifically.
Well, we're not saying that they go out and do mass screenings. What we're looking for are certain symptoms. For example, tumors of the brain might manifest itself by having difficulty walking, change in behavior, increase in headaches, difficulty with vision. If your child starts presenting these things, don't just ignore it or think that they're just going through a phase. Get them to the doctor, get them to get worked up, and the doctors will then help you. And by my going out to the physicians and to the pediatrician and saying, hey, this rate is increased, we need to be looking for this, that will help the medical community be more aware of this. We have not found anything in the environment that would point to a cause. So from that perspective, I think that we have to look at, most cancers have perhaps, the best way to describe it is that most cancers have a genetic component with a trigger in the environment that might set it off. And so we ask the question, why would one family have a child that has the cancer and the other child not have that cancer when they live in the same environment, live in the same home, eat the same foods, but yet one child gets it and the other one doesn't? I would imagine that as a parent, whether your child is still alive and has had this, or your child has died, what you want is a sense that your child has not gone through all this suffering in vain. So I will hope to be able to work with these families to be able to do exactly that. Improve the awareness, improve the medical community's awareness in terms of diagnosing these kids early on, and I will encourage them to continue to tell their stories so that other folks and families who have children who have abnormal presentations get taken to the physicians in a timely manner to, again, early diagnosis. So that would be one of the things that I think will happen as a result of having done this study and bringing awareness to our whole community, to the whole South Florida, to the nation, all around.